I will now turn it over to Paul DiLorenzo, a Center for States consultant with our Prevention National Authority team and our moderator today.
Good afternoon, everyone. Hope you're doing well. Thank you so much for joining us. So grateful. We have a crowd of several hundred people, which is phenomenal. This is really wonderful content we're going to do today. Great presenters. Any one of the issues that we're going to discuss will be a whole day, but I think we're going to be really efficient in the way we cover as much material as possible. First, let me do introductions of my colleagues here that are with me. We have myself, I'm from the Center for States, as Chris mentioned. Mary Jo Caruso, who's from the Friends National Resource Center. We have Athena Cote and Borja Alvarez de Toledo from the New Hampshire Department of Health and Human Services and the New Hampshire Community Collaboration Grant. We have Jackie Green from the Florida Department of Children and Families. And we have Keith Fanjoy from the Sanmar Family and Community Services and the Bester Community Health. This is really a wonderful group. I know some of these folks have worked closely over the years, and I, again, can assure you, you're going to hear some wonderful content. Let me go on to the, if we can cover the agenda for the day. It's an ambitious agenda. As I said, we can spend a lot of time on all of these things, but we only have a limited amount that we're going to be able to spend with you. We're going to do, first of all, we want you to hear about the benefits of building effective and trusting partnerships. We want to be able to share a few tools on how to support building trusting relationships across these collaborations. What does a trusting partnership look like? We're going to have a short time for panel discussion, and then we'll close up the day. And then let me also talk about the objectives for our webinar here today. The objectives are pretty clear, but I want you to think of today's conversation as a crash course on the core elements of collaboration and partnerships between public child welfare agencies and a variety of both traditional and non-traditional organizations. I think our presenters are going to do a pretty good job of showing you how these strategic partnerships are the means to an end. They're not the end in themselves, but the end is to be able to accomplish the goals of child safety and family well-being. So during the course of this webinar, we want to be able to increase your knowledge and the awareness of effective collaborations. We want to help you recognize what's needed. If you're from a child welfare agency today, what's needed to improve collaboration with not only your public partners, but your community partners. We want you to identify the purpose and the importance of establishing shared goals and values with public agencies and community partners. And finally, we want to be able to share very effective strategies, both in starting and maintaining collaborative partnerships between and among child welfare agencies and community partners. So let's do a little bit of stage setting. We'll go on to the next slide. And what does trust matter? Why does trust matter in these effective partnerships? I think there's a few things I want you to hear about this. It seems to me that that up until recently, there haven't been a lot of consequences for not collaborating. And what we are seeing more and more, partly because of Family First, partly because of the growing body of evidence that better results emerge from these partnerships and collaboration, is that more child welfare leaders are finding their ways into some very interesting collaborative arrangements and community arrangements. In my work on both sides of the collaborative table, the issue of trust is really a critical one. In large part, because the child welfare agencies have to trust not only in the partnership, but in the ability of those partners to be part of the child and family safety continuum. And this is a real concern. We understand that. There has to be a local commitment to problem solving that always has to be present. And frequently, the child child welfare agencies need to be conscious of two things. Local community partners have a tremendous energy, enthusiasm, desire to want to do problem solving. They don't always have the local capacity to do that. And that's why the partnership with the larger public agency becomes so critical. The flip side of that is that large bureaucracies are good at accomplishing certain things, but not necessarily those more granular local collaborations that need to happen. And so they have that need for support from their local partners for that culture shift that needs to take place. But the truth is that there are more and more success stories in these collaborations that are emerging. You're going to hear some today. I think actually some of them are wonderful. And the reason that they've been successful, let me just kind of give you a preview of what you're going to hear.
Thank you. I'm Mary Jo Alamina Caruso with the Friends National Center for Community-Based Child Abuse Prevention, or CBCAP. Community-based child abuse prevention programs are funded under Title II of the Child Abuse Prevention and Treatment Act, or CAPTA. The funds are administered at the state level by a governor-designated state lead agency to promote primary and secondary child abuse and neglect prevention efforts. Friends is funded by the Administration on Children, Youth, and Families and is a service of the Children's Bureau to serve as the training and technical assistance provider for CBCAP, state lead agencies, and to promote the purposes of CBCAP. Friends is a division of the Chapel Hill Training and Outreach Program Incorporated in Chapel Hill, North Carolina, providing services to the CBCAP community through targeted training and technical assistance efforts and partnering with other national organizations and initiatives with the aim of preventing child abuse and neglect and supporting families. Friends services focus on primary and secondary prevention and targeted training and technical assistance on a variety of topics such as public awareness programs and initiatives related to child abuse and neglect prevention, community collaboration, networking, and collective impact, in collaboration with child welfare systems change efforts, including program improvement plans, child and family service plans, annual progress and services reports, and the Family First Prevention Services Act. Many of you may be familiar with the high-quality information we provide to the general child abuse prevention community through resources such as our website, which you can see here. On the Friends website, www.friendsnrc.org, under the Resources tab, you'll find information and strategies about the benefits of collaboration with child abuse and neglect prevention efforts, such as how collaboration promotes innovation, how working together can help ensure efforts and services are more efficient and effective, and how the sharing of resources and knowledge can make overwhelming tasks more manageable and fill the gaps in technical expertise. Collaboration is explored in depth in the Friends Collaboration Toolkit, which focuses on 10 elements that, when incorporated into cross-agency work, can strengthen collaboration and improve outcomes.
Image of the Friends webpage for the Collaboration Toolkit.
On our next slide, you'll see that evidence-based and evidence-informed programs and practices are integral to prevention. So are partnerships. Research shows that when agencies work together, there are all kinds of positive outcomes for the agencies, for their clients, and for the communities they serve. Keeping in mind that collaboration is not about directing the work of individual partners. It's about aligning efforts to move more quickly and more effectively toward the common goal of eliminating child abuse and neglect. This collaboration toolkit provides 10 elements that can be incorporated into both everyday and intentional efforts to enhance collaboration. The 10 elements provide opportunities for exploration and growth in a variety of areas.
The 10 elements in the toolkit are hope, mindset, authenticity, rules of engagement, conflict, intentionality, likability, adaptability, trust, and informal relationships. As an example, the toolkit entry for intentionality includes a definition, things to remember, resources, and tools.
Such as introspection and personal reflection, explored through the elements of hope, adaptability, and likability, or social and emotional traits, explored through trust and informal relationships, and group dynamics, explored through conflict, rules of engagement, and intentionality. These are all essential elements of understanding how a group can collaborate so that collaboration can be targeted towards common goals and positive outcomes for children, youth, families, and communities. The Friends Collaboration Toolkit has been designed as a user-friendly reference to challenge your thinking and support your progress around collaboration. These 10 aspects appear easy to incorporate. However, we often overlook them in favor of checklist-type approaches to working together. With this toolkit, we will elaborate on the 10 elements that support collaboration work so that you and your partners can determine which one or more may be beneficial to achieving effective collaboration relationships. The toolkit provides robust information on each of the components and offers materials, resources, and research that support development of effective partnerships. For each of the 10 elements, you'll find a description of the collaboration element, takeaway points to consider, resources such as a community toolbox, TEDx talks, books, diagrams, and other resources, tools you and your partner can use to provide a hands-on learning experience, and research you and your partners can read, including references, studies, and methods that have proven effective in everyday efforts and intentional collaborative work. The toolkit is designed to help facilitate thinking in terms of collective impact and to introduce new terms. So how might a group decide where to start? It might be helpful to explore how your colleagues and jurisdictions have used one or more of these elements in their collaboration work. On this next slide, we'll see that collaboration in child abuse and neglect prevention partners means finding intersections and looking for creative ways to connect, share resources, and collaborate across programs and sectors. This means occasionally working with unlikely partners and always being willing to think differently. By finding ways to partner with other organizations, we're able to better address the systems that impact families and to increase positive outcomes, reduce duplication of services, and prevent child abuse and neglect. CBCAP prioritizes collaboration, defined as 2 or more agencies working together to help maximize the use of limited prevention dollars. Working with cross-sector partners who have a vested interest in child abuse prevention, states and communities can improve service delivery systems and increase the effectiveness of programs. An increasing number of community and state-level organizations are working together to improve supports for families. The brief Child Abuse Prevention and Child Welfare, Collaborating for Creative Solutions, available on the Friends website, is a resource that can help state and local agencies and other leaders in child abuse prevention in their efforts. This brief describes federal legislation and guidance that addresses collaboration, identifies common ground between prevention and child welfare entities, provides strategies to strengthen collaborative efforts, and features 6 states that are demonstrating leadership in improving family-serving systems. The brief also provides information on which aspects of the toolkit were used by sharing examples.
The brief pictured includes the quote, "Coming together is a beginning, keeping together is progress. Working together is success," from Edward Everett Hale. Collective impact. How does this relate to the concept of building trusting partnerships to strengthen families?
Of how CBCAP state lead agencies are effectively collaborating with prevention partners, child welfare agencies, and local communities. For example, Delaware used the concepts and strategies addressing trust, authenticity, and adaptability to strengthen relationships with the state's child welfare agency and partner agencies. The initiative led to the 2 organizations sharing their resources and expertise to support and strengthen caregivers and their families, which in turn help prevent placement disruptions and support success in the goal of decreasing the placement of older children entering care by providing kinship caregivers the tools that they needed. Additional committee outcomes led to improved collaboration across foster care agencies statewide, policy and procedure reviews, and work groups that arose out of the Program Improvement Plan after the state's CFSR. Just as important, there was trust and authenticity that developed between the agencies that has facilitated vulnerability and an openness to feedback, even in the most difficult situations. On the next slide, we'll see collaboration is not a new concept. People have been working together throughout the history of social services. In the face of shrinking resources, funders and social service organizations alike need to find innovative approaches to maximize resources and optimize outcomes. Collaboration has the potential to improve access to services, coordinate care, and keep families from falling through the cracks of the system. Most federal and foundation funding requires partnerships and collaborative efforts as a means to reduce duplication, coordinate services, and assist families to navigate what has been described as a fragmented system. These collaborations often require agency positions to be part of the membership team and most often take the shape of councils, collaborative work groups, and leadership teams. To do this well, collaborative teams need to focus on developing strong informal relationships and using formal interactions, such as meetings, to encourage meaningful communication. So, what steps might stakeholder partners take to create those shared values and goals? Community-based child abuse prevention programs can kickstart collaboration by being hopeful. And hope means not only believing that the future can be different, but recognizing that you have the ability to do something about it. Hope can inspire people to work together for renewed interest and purpose towards a common goal. Check your mindset. The mindset of people involved in a collaboration can serve as a catalyst or a barrier to change. Mindset enables individuals and the group to commit to taking risks and failing forward in order to accomplish goals. Practice likability. Likability is not about being nice. It is the attitude and approach you bring to the collaborative work. Your likability factor has a strong influence on whether others approach or avoid you, work with you, or steer clear. Be flexible. Adaptability is essential in complex dynamic work like child abuse and neglect prevention. The ability to adapt when confronted with changes or when unforeseen problems occur makes a big difference in the likelihood of success. Establish rules of engagement. Recognizing the often unwritten rules of how we work together builds a common understanding of not just why we're doing this work, but how we're doing it. Rules of engagement can guide how interactions should occur, how to handle conflict, and when to call it quits. Embrace conflict. Although conflict is often seen as negative, it can serve as a way to be real, authentic, and ultimately foster individual and group growth. Be intentional. Spend time reflecting on whether you are achieving your intended goals or just going through the motions. Be real. Authenticity can serve to break down barriers to keep partnerships moving forward and doing meaningful work together. Build trust. In collaborative work, where conflict does and will occur, trust enables the work to continue despite differences of opinion. Trust is the foundation for any relationship to build upon in order to overcome bumps along the road. And finally, build meaningful relationships with your partners. We often take relationships for granted, but relationships are the key to effective collaboration. So devote time to engage in conversations before or after meetings. Invest in the time and energy to express care and provide support because the return on investment is huge. Child abuse prevention partners really do greatly benefit from a model of collaboration that focuses on these aspects and works towards new, innovative ways of combating child maltreatment. I'm now going to turn the presentation over to Athena to talk about community collaboration in New Hampshire. Thank you.
Thank you, Mary Jo. Hello, I'm Athena Cody with the Department of Health and Human Services, and I'm also the project director for the Community Collaborations to Strengthen and Preserve Families grant within the Division of Public Health. And also I work within the department to understand and support the alignment of our early childhood systems across each of our divisions under DHHS. Next slide, please. In the last 2 to 3 years, New Hampshire has worked to integrate and connect our programs, divisions, and policies across boundaries within state and community agencies. By refreshing and modernizing the DHHS structure and partnerships across each division, we have been able to do a number of things, such as prioritize early childhood, developed a New Hampshire strategic plan for early childhood, establish a 10-year mental health plan and state opioid response, New Hampshire Council for Thriving Children, whole family approach to jobs integration teams, focus on parents working and children thriving, and preschool development grants, just to name a few. New Hampshire has used the social determinants of health lens as the foundation for alignment and integration across all of our DHHS efforts.
The social detriments of health diagram features each of the determinants in its own circle and connected to the others in a larger ring. The determinants are neighborhood and built environment, health and healthcare, social and community context, education, and economic stability.
This early work, led by our previous Associate Commissioner, community partners, and division leads, to reshape the child welfare system in New Hampshire while valuing cross-systems integration to coordinate the work and initiatives across New Hampshire. This was critical foundational work that strengthened our early childhood system that we have today. Now, 2 years later, boundary-spanning leadership at the state and community level has been the sustainable framework that has allowed New Hampshire to strengthen its early childhood statewide system in partnership between communities and state agencies such as child welfare. New Hampshire was primed to receive the Community Collaborations to Strengthen and Preserve Families grant. And my colleague Borja is going to talk to us more in a couple of slides about his experience and membership of the Child Welfare Systems Transformation Team, and more recently through another integration team to support families during COVID. The work of Community Collaborations is focused in testing new prevention models to support seamless delivery of services to families at the community level, which has been enhanced through cross-division and cross-sector partnerships within the community. Next slide, please.
The grant also supported expanding the use of evidence-based practices to strengthen families.
In the last few years, New Hampshire has had a number of early childhood community-based programs that support young children and their families, all working really hard to meet families' needs, but which had not been as well coordinated. Place this on top of increases of child maltreatment rates and foster care entry, and we have the conditions where the patchwork of services and supports can leave families at risk of falling through the cracks.
In other words, there was a problem with having multiple entry points to access services.
Our pathway for change in community collaborations is guided by a vision for unprecedented coordination of state agencies to ensure more effectively aligned efforts at the state and community level. We need to ensure that families have what they need when they need it and reduce hassles for accessing supports through resource navigation. What we mean by that is we need to strengthen our cross-sector relationships to reduce barriers to families getting access to needed supports. We're using new leadership approaches and more sophisticated data resources to support system changes and increase protective factors for families. Boundary Spanning Leadership Framework has the capability to create direction alignment and commitment across systems and deepens collaborative approaches.
The pathway to change also includes use of evidence-based practice to focus on increasing protective factors, community implementation teams, predict, align, prevent, and resource navigation for families.
The outcomes that we're seeking in community collaborations are to ultimately reduce the number of children entering foster care and the number of referrals of child maltreatment. The 3 locations of focus in New Hampshire have been the City of Manchester, our Winnipesaukee Public Health Region, and our North Country. Next slide, please. Part of our pathway to change is through Boundary Spanning Leadership, or BSL, at the state and community level. BSL is a new way for us to talk about and manage this complex level of coordination and collaboration across systems. The model is based on over 10 years of research on what makes successful collaborations and what makes them fail. BSL research indicates that collaborative groups, those who gather for shared work, they often start immediately at solving the problem, which is great. However, what was found was as groups continue to evolve and work to find cross-sector solutions, the group starts to falter. People may disengage or can't or won't commit to the change needed because they've missed an important first step in managing boundaries, which is understanding from the beginning of the collaborative what are the unique attributes of each organization, but also what are their limitations, such as resources or geographic boundaries that might be getting in the way. By starting with managing boundaries, groups can unpack the barriers and restrictions, and they can move forward to transformational work. They're well positioned as a whole group to move forward, and the group has a foundation to go back to when they get stuck. Building on a collective impact model, BSL invests in the foundation of building trust and safety among all of the systems that need to come together to make transformational change. Important strategies in the beginning of collaborative work is identifying direction, alignment, and commitment. Direction is that agreement in the group on the overall goals, and when there's strong direction, members have a shared understanding of what group success looks like, and they agree on what they're aiming to accomplish. Alignment is the coordinated work within the group, and with strong alignment, members with different tasks or roles or with different sets of expertise can coordinate their work. And commitment is the mutual responsibility for the group. In groups with strong commitment, members feel responsible for their success and the well-being of the group. And they know that the other group members feel the same. They trust one another and will stick with the group through difficult times. Our community collaborations partners in Manchester have shared that by seeing the transformation changes happening at the state level alongside community agencies.
In a graphic form, circles representing direction, alignment, and commitment overlap, and the overlapping middle segment represents leadership.
Adding numerous layered initiatives and programs to ensure strong New Hampshire families, community collaborations came about at the perfect time and what was needed to boost prevention strategies and services to families. Local teams have been engaged with the child welfare system in ways that have not been seen before. Communities see as a state, New Hampshire values the necessity to collaborate and coordinate. There's engagement and buy-in at the state level leadership and staff to be part of work, which has been strengthened by those community relationships. The pandemic also brought together additional partnerships and co-led projects to support families, such as the New Hampshire Protected Factors Coloring Book. And mental health and substance misuse supports have been great partners through this effort, and the Manchester local team. Some of the tips that the team would share is that there has to be an investment in collaborative work, and then engagement of partners can occur. Using the BSL framework, it's been crucial to identify your mission, vision, values of the group, and guiding principles. For the City of Manchester, having localized cross-sector partnerships was developed through leveraging existing relationships. Coordination and collaboration often happens situationally, and through this expansion, starting with early project launch work and through community collaborations, the relationship across partners has been more intentional to support a framework of engagement that benefits all families. Having members that have existing relationships to pull from has been helpful to build trust and engagement. And sustainability over time through that trust means that more difficult conversations can happen, members are engaged, and solutions can be transformative. Everyone has a shared purpose for the work, and everyone knows their role. And right now I'm going to pass it on to Borja, who will talk more about his experience.
Thank you, Athena. Can we have the next slide, please? Thank you. So my name is Borja Alvarez de Toledo. I'm president and CEO of Waypoint, which is a social nonprofit agency in New Hampshire, and we've been around since 1850. So I really wanted to share my perspective with you as a provider and give an example of how the collaborative groundwork that Athena has described was really the foundation for a coordinated response during COVID-19. If we go back 4 years ago, and following the tragic death of 2 young children that were in the system, an audit was conducted of our child protection system and revealed really serious problem. 27 recommendations were made. I'm sure many states have gone through processes like that, and they're tough, traumatic, but they're transformational at the same time. Just to give you an example of how bad the situation was, caseloads for assessment workers were 90 cases per worker. So a team was created, which Athena has mentioned, the Child Welfare Systems Transformation Team, with a clear understanding that it will take a collective effort to reverse course and change the system. For 2 years, a number of state agencies, representatives, providers, community leaders, advocates, legislators, parents met monthly and were introduced halfway through to the boundary spanning leadership that Athena has shared with you. You know, in New Hampshire, like many other states, 100% of the services are contracted from the state to community agencies. This was completely unprecedented work. We had never, as a provider, been invited to sit at the table with the state and other providers and try to solve what seemed like a very, very complicated process. The result was really an honest, transparent, trusting, and focused collaboration that really has set the stage for many, many changes in our welfare system. Now, I want you to move forward to the end of March of this year. There is a stay-at-home mandate. There are no schools, no therapy, no pediatricians visits, no home-based services. DCYF is not going to the homes to conduct evaluations. Everything is going through telehealth. And 2 weeks after that order was put in place, calls to child protection services dropped by 50%, even though we all knew that families were under enormous stress and abuse and neglect was probably on the rise. We had another crisis in our system. Once more, the state knew that they could not be able to solve the issue alone. But this time, they had trusted partners to help. So a call to action was made, and a group of us, about 12, Athena was part of this group as well, around 12 of us really met weekly for a couple of hours to try to come up with solutions, understand the situation, and see if we could really prevent the pervasive abuse and neglect that we knew was happening and was actually undetected. Next slide, please.
This call to action was based on transformation of the child welfare system. The interagency team meetings led to a monitoring group and other activities. A data call to action included focus on April, National Child Abuse Prevention Month, and the collective responsibility to ensure that families are safe and supported.
So this is just a representation of a lot of the initiatives that happened through this partnership. And I'm not going to list them all because there were at least 20 different initiatives in the 3 months that we met. But let me name a few so you understand the caliber of what we were doing. So all of us in that group had connections to different media people. So we leveraged those connections to really alert the whole population in New Hampshire about the issue and really ask for help. We knew it was beyond the group of 12 that was meeting. It really was a collective effort. So during many weeks, we had TV interviews, radio interviews, newspapers, articles, social media campaigns, public service announcement. And it was really important work, the information and leveraging all of our resources. A second initiative that happened is, as you probably know, April is the Child Abuse Awareness Month. And the state decided to do a proclamation, and there was this thought that maybe the governor should actually read the proclamation. And actually the group said, no, that's a bad idea. Why don't we actually have a video produced where actually kids read the proclamation? So it was a very, very good, well-produced video of kids reading the proclamation. And it really went viral, and all of us used our social media to disseminate the video. My agency, Waypoint, started a family support warm line. So where if you made a call, you would be connected to a family support specialist to get parenting advice, to get support. And we received hundreds of calls with parents that really did not know how to navigate the stresses of having kids at home, working remotely, trying to help their kids learn in school and do classes remotely. We also had campaigns with pediatricians about the importance of well child visits. We knew that those were not on the top of the list for pediatricians because it was through telehealth and it was very complicated. And we did a whole campaign about, please, we need you pediatricians to lay eyes on our kids so we know that they are safe. Anyway, these are some examples. There were, as I said, about 20 different initiatives that came with the group. But what I really want to say that the result of this is we didn't completely reverse the trend, but we were able to see through all of these efforts really an increase in the number of calls to child protection. And we continue to monitor weekly to this day what's happening with that. In conclusion, just to stress that this collaborative effort around COVID-19 would not have been possible without the 2 years of work that have preceded. And I believe that it's not only as a provider, it's been incredible to sit at the table with the state, with other providers, with community leaders, with legislators, and try to solve these very complicated issues. But I think we have created a culture in a state where child welfare is understood to be a collective responsibility. That finishes my presentation, and I think I'm turning it back to Athena.
References for this portion of the presentation include Boundary Spanning Leadership, Center for Creative Leadership, https ccl-innovation.org/wp-content/uploads/2020/002/boundary-spanning-leadership.pdf. Community collaborations to strengthen and preserve families, New Hampshire. https://www.dhhs.nh.gov/dphs/bchs/ccspf.htm. NH Council for Thriving Children. https://www.dhhs.nh.gov/ctc-council.htm. NH Preschool Development Grant, UNH. https://mypages.unh.edu/pdg/home. New Hampshire Strategic Plan for Early Childhood, Council for Thriving Children, NH, DHHS, NHDOE, UNH. https://mypages.unh.edu/sites/pdg/files/pdg/files/nh_ec_plan_2020.pdf. NH Strengthening Families Coloring Book, DPHS, NH Children's Trust, Launch Manchester, Lakes Region Community Services, Coos Coalition for Young Children and Families, FSNH. https://48EB136-1C4E-422-93-C-676-C453-6510E. files/USR.com/UGD/38C-037_4C0E9F4D-CD167F2-EBD.pdf. Waypoint NH Family Support Warm Line, https://waypointnh.org/programs/the-family-support-warm-line.
Thank you, Borja and Athena. Hello, everyone. I am Jackie Green. I'm the Circuit Administrator for the Florida Department of Children and Families. Thank you for allowing us to share one of our great system of care stories from Jacksonville, from the Jacksonville area. Next slide, please. In 2006, when assessing the increase in the number of children entering out-of-home care, the Department of Children and Families in the Northeast region of Florida and Family Support Services, our lead community-based care agency, realized that there was an urgent need to explore an effective prevention strategy to stabilize the families and improve the outcomes for abuse and neglect before it occurred. It was overwhelming, to say the least. Research showed us that children, of course, that we all know, that children placed in out-of-home care versus those receiving less intrusive services, the outcomes were just inadequate. So based on that research, we had to develop some type of way, some form of prevention services that would help to stabilize our families, because it was just, it was overwhelming. And as a result, an in-home non-judicial program called Strengthening Ties and Empowering Parents was developed and created. This would allow us to focus on those services in the home. Next slide, please. When we started the whole process, there were almost 2,300 children in out-of-home care. But based on our concerted efforts and STEPS being one of them, and I will explain later the other programs that we coupled with that focus on STEPS, we were able to decrease the number of children coming into care by 62%. And it was no small effort, but systematic partnership, the programs and creative ways of using our 4E dollars upfront, those prevention dollars, helped us to sustain and create and sustain wonderful outcomes for our families. So you can see that in the bar graph, the number of children in the STEPS program, and then our number of children in out-of-home care.
The bar graph shows that there were 2,238 children in out-of-home care and 2,113 children served by STEPS in 2006. In 2007, there were 1,801 children in out-of-home care and 2,901 children served by STEPS. In 2008, there were 1,106 children in out-of-home care and 4,607 children served by STEPS. In 2009, there were 839 children in out-of-home care and 4,004 children served by STEPS. In 2010, there were 869 children in out-of-home care and 3,741 children served by STEPS. In 2011, there were 915 children in out-of-home care and 5,585 children served by STEPS. In 2012, there were 826 children in out-of-home care and 5,760 children served by STEPS.
But it was no small feat. In that 6-year period, we got there ahead of schedule because we took up the challenge given to us by Casey Family Programs and exceeded that. But it was not without hard work and wonderful creative partnerships. We had a very innovative leader at the time of our department, and she had come from the private sector and was not afraid to ask the hard questions, which she did. And it took us a while to come up with the name. It was in foster care as we know it. We tossed around lots of acronyms, but in the end, we came up with Foster Care Redesign. That was something everybody could get their arms around, and it was easy to explain to our community partners that we needed to have on board because we knew that we couldn't do this alone. We saw the grandmothers that were coming into the senior center that I will talk about later, that were having these discussions around the bridge tables. They were taking in their grandchildren, and those numbers began to escalate. So getting our arms around the community piece was a collective effort that helped us to achieve that goal. Next slide, please. So as we partnered to create the STEPS program and this four-pronged approach to keeping children safely in the home, there were these pillars that we created. We had community resource specialists. They were right there in the community where they could be easily accessed. And these were for folks in the neighborhoods that had no immediate child safety issues. There was a DCF or one of our investigative referrals could make referrals to a community resource specialist for assistance for a family. And then they were co-located together at our community resource center, which we call the Shell Suite. The Shell Suite Community Resource Center is located in the heart of urban core in Jacksonville, and uniquely on the campus of Edward Waters College, one of the oldest historically Black colleges in Florida. And it was also a neighborhood resource center, small but yet effective, that the community was aware of. They could go in for services, but they were minimal. So we thought it would be good to co-locate some of our resources and to partner with the Shell Suite to provide the services that the community needed. In addition to the STEPS program, and we identified those families that were There were incidences of potential abuse. The children were safe, but high risk because of the stressors involved. There was a need for preventive services and monitoring in the home. It was a 3 to 4 month program where these families received case management, parenting, budgeting, and behavioral modification in the home. When the child could be safely maintained in the home, we put services in the home to stabilize that family, walk alongside them, create stability, and maintain it. And then in those instances where there were a few more safety factors, there were higher risk, Family Assessment Support Team, the Family Assessment Support Team, which is FAST, the acronym FAST, that was a program, 24-hour response, 6 to 9 months, certified caseworker, partnered with that family, and in-home therapy was provided on a several times a week basis to stabilize that family, to monitor the safety, to make sure that the family had what it needed. And then we had another specialized program, the high-risk newborn services, to help us focus on our birth to 5 population. Services also were provided in-home, and those cases were referred to us by our internal mechanisms through DCF, the FAST program steps, or from our integrated practice team. And our integrated practice team is the opportunity that we had all of the folks involved in a particular case around the table to strategize the best outcome for that family. So with the integrated practice team, you have behavioral health specialists, you have investigators, you have mental health counselors, sometimes Department of Juvenile Justice, whatever services were needed for that particular family to stabilize them, they were around the table and part of that integrated practice team to try to chart a course for the best course of action for that family. Next slide, please. So most definitely, we couldn't do it by ourselves. We had to have the cooperation of our community because we were a state agency, a unique one nonetheless, but we needed our community to walk alongside of us. We needed the folks in the neighborhood who were the eyes and ears, who walked the children to school, who provided those unofficial supports to work with us, to be our eyes and ears in the community, to help us to navigate and chart our course. Next slide, please.
Examples of needed community cooperation and support included strength-based engagement, perspective, relationships, etc.
And here, in 2008, after we had done the upfront work, identifying what the needs were, narrowing it down, we looked at the zip code, and it took us back to the urban core in a particular zip code of 32209, where there were the highest incidences of poverty, infant mortality, health disparities, and abuse calls to the hotline.
Map of Florida with the 32209 zip code land area circled. The Department of Children and Families and Family Support Services of North Florida continued community outreach to determine which communities had the highest number of removals and hotline calls.
So that was the area that we chose to target, and we concentrated our efforts there. Next slide, please. So in that, I spoke earlier about the Shell Suite Community Resource Center. It is the only certified senior wellness program in the city, but these were not seniors that were they were very active, to say the least. They were the ones that volunteered at the local schools and participated in food giveaways and other community service projects, in addition to their wonderful bridge clubs. But more than that, they had been accustomed to providing services, those unofficial supports, concrete supports to folks in the neighborhood. So we thought it was a great opportunity to go in and ask if we could assist them to ask them to walk alongside us. And they also were very open in sharing their stories of the grandparents that were there who had these unofficial, that were in unofficial relative caregiver roles. So DCF, Family Support Services, and our friends at Casey Family Programs came together, partnered with us to help us chart a course to really impact the number of children coming into care, and thus the foster care redesign system was established. It involved bringing all of our local community leaders to the table. They were aware of the situation. They were aware that there were a large number of children in foster care in that community, and they wanted to do something about it. Historically, it had almost become acceptable, but they knew that if there was an opportunity to change that trajectory, they wanted to be a part of it. So we met with the local leaders, the community leaders at the Shell Suite Community Resource Center. We brought everybody to the table and we asked them what their recommendations were, what they wanted to focus on. And from their feedback, we identified the areas that we could support them in as they were helping us to meet our goals. And one of them being health disparities. There was a clinic there that had provided some community resources and medical supports that closed. So one of the goals was to help them to reestablish that community support. And we worked very hard. That was one of the initiatives that we could partner with them from the state level as well as the community level to help them to reestablish that connection so that the seniors that were there as well as the children for which they cared would be serviced in one location. Next slide, please. And in that small space, you can see a number of community resources. War on Poverty, they were there to counsel on finances. Northwest Behavioral Health Counseling for mental health services. Three Rivers Legal Services could provide information on small law concerns that many folks in the neighborhood had as an issue. AARP, Healthy Start, Family Support Services, Elder Source, Florida State College at Jacksonville provided GED and pre-GED programs. The Sheriff's Advisory Council was there to help with minor law enforcement when needed. Veterans Reintegration Program. There were a multitude of partners, all that were rotating in and out of the Shell Suite program, the Shell Suite Center, to provide the services that the community needed to stabilize those factors, those programs that we had placed in the homes. And it was, it proved to be very successful for us.
Other collaborators included United Way, the City of Jacksonville, DCF, Choice Counseling, the Mayo Clinic, PSI Family Services, Edward Waters College, Shell Suite Community Healthcare Clinic, Teen Leaders of America, Magnolia Project, University of North Florida, WorkSource, Casey Family Programs, Jewish Family and Community Services, and United Healthcare WellCare.
Next slide, please. So the lessons learned from this, it sounds like I know it sounds wonderful. We have all these wonderful resources, and we did. We had wonderful partners that came to the table with us to help to meet our goal of reducing the number of children that we were bringing into care, but it did not come without a cost. It was very, very challenging work, as challenging as it was rewarding, but there were a lot of great lessons learned. In the beginning, we recognized that the community was not very trusting, especially of state programs, because there were various other programs that had come in and mined the community for research, made promises that they didn't deliver on. And that was very, very tragic, very costly for relationship building. However, we know that when relationships are broken through trust, they must be healed with trust. And we work very hard to meet the community on its terms, to go in and have the community meetings and to listen. That was the most important thing, not tell them what they needed, but to listen and hear what they thought they needed and then commit to providing that resource. And one of the most important things that we learned was that the work had to be sustainable and measurable. We found that this community was so giving with so many resources, they just did the work. And there was really not a whole lot of documentation. They just wanted to get it done. So we had to share ways of measuring success and what that success looked like. And then the sustainability, because there were grants and opportunities that came, but they also went. And they had to recognize that the work needed to be sustained and to not rely on just one source of funding or one source of support. And then to establish a foundation that can be leveraged in the future when we all got around the table and we were working toward that same goal. And even as the numbers began, after we met the goal, we sustained it. And then the last few years, the numbers began to tick back up. We also had an increase in violence in this community. So we shifted gears to focus on a trauma-informed community, trauma-informed care. But many of these relationships were organic and transferred over because we had yet another combined goal that we could work toward because it was going to benefit our entire community. So we didn't have a whole lot of problems with transitioning, bringing that whole team that helped us to redesign the foster care system is helping us to create and move toward being a more trauma-informed community to help us address the number of children that were being caught in crossfire. So in that, we have learned from our challenges. We have learned that that honest and open relationships, healing has to occur, and that we can also, when we have acted in good faith, bring those same relationships to help us to address new issues in the future when they arise and to move toward a stronger community for us all. And now I will turn things over to my colleague, Keith Fanjoy in Washington County, Maryland.
Thanks, Jackie. Wonderful program in Florida. We've had a chance to visit the STEPS work and stole a bunch of stuff from you guys. So thanks for all you do. Again, I'm Keith. I'm with Sanmar Family and Community Services. We're based in Western Maryland in Washington County with the city of Hagerstown at the core of Washington County. Next slide. If we kind of would start with some of the Sanmar history, I think that'll set the stage for understanding kind of how we got to where we are today. So Sanmar, like many child welfare organizations, started as an orphanage 136 years ago in downtown Hagerstown. After the creation of the orphanage, there was just a lot of community need, and the community came together for kids. You know, kids at that time were viewed a little bit differently in the 1800s as far as their utility for a family. And so, but the community came together and said, we need to do something, right? So there's this particular community in the southern portion of the city of Hagerstown, and we were there for about 44 years. And around 44 years into our history, there were concerns about community conditions in the south end of the city of Hagerstown, prostitution, crime, socioeconomic issues, and a place was identified about 10 minutes outside of town in the little humble town of Boonesboro, Maryland, that had a 60-acre campus. And so the orphanage moved to Boonesboro, and it was a sanctuary. It was a beautiful place. It remains that today. And it was seen as a place of healing for children, but it was not in the neighborhood anymore. You know, we had kind of continued for years and years and years in different variations of residential and foster care services over the course of our long history. And to the point where we kind of reached the pinnacle for us in 2005, there were stories across the country about major problems in out-of-home care, major concerns with residential services. And the Baltimore Sun ran a national piece for 5 different articles about major challenges occurring in group homes. And the 5th article of the 5 was about Sanmar, saying that, you know, not all group homes are bad, not all group homes are good, but when it's done right, this is what it looks like, you know. And so it didn't matter that Sanmar had this great reputation as a residential provider. At that time, our bread and butter was serving adolescent females in residential programs, and we also had foster care services with boys and girls of all ages in foster homes. But the die was cast, the residential transformation was underway at the state and national government level, and we just weren't really totally aware of that yet. So I use the term pre-contemplation when we think of DiClemente and his framework of, we kind of weren't in a place where we were thinking of changing our work, in the early 2000s. We were really justifying it and advocating for how good we were doing because we looked at the kids we were serving, we knew the stories, and we felt like we had this wonderful place that was making a difference in the lives of kids. Next slide. So we began a process, one more slide, yeah, you clicked back. We began a process as an agency where we started really thinking about, is there a better way for us to be doing this? And it really starts with anybody that's in this work. It comes with the heartbreak of stories of kids who join our organization in some capacity and thinking about what if somebody intervened earlier, and what can we do? And at that point, we thought about, well, we're going to help this kid in front of us, not thinking upstream. And we started to hear and learn about processes undertaken by other organizations and thinking about if there was a better way, then really we had a moral responsibility to respond. Because prior to that, we didn't really have the education or knowledge of a different way. For us, everything starts with what we believe and our core values and our commitment to it. And as you think about this slide, every organization is going to have a different version of what it is that they believe and what their core values. But I think for us, it was really existential in nature. We're thinking about why did we join this profession? What is it that brought us into providing social work and child welfare services? So, when we talk about whatever it takes, we think about what would we do if this was our own children? We think about the kids in foster care that we're serving like our own children. And what would we do? We would go further. We would go the extra mile. We prioritize relationships because we understand that with kids, if we have a trusting, caring relationship with a child, that therapeutic relationship can help us, right? We take time to have fun as an organization with kids and with our staff because self-care is a major issue in this profession, and we try to go above and beyond to do those things for our staff. Better Together, you've heard the terminology today about collective impact, and it's very important to think about how these are very complicated problems and we can't solve them by ourselves. Oftentimes, it does take leadership for an individual agency or a couple individual agencies to step forward and say, we're going to do it. But long-term, you need lasting partnerships that are going to help you accomplish kind of population-level goals. And I think the thread that goes through kind of all our programs is this idea that everyone has strengths, that so many of the kids that come to us have been identified as having problems or families that have problems, and it's our job to identify their strengths and build on them. So, I guess I'm pointing out these values because so often when we think about this work, we start with the solution. We start with, this is what we're going to do. We're going to go here and we're going to start fixing things. And we don't first look at ourselves and our organization and think about what is it that we're about and why are we doing this in the first place. So again, if you think of stages of change in the framework of an organization, not just an individual, we were in the place for a couple years of examining how do we do things, why do we do things, how did we get here? This doesn't just happen with a couple quick meetings internally where we agree that we're going to do something different. It takes time to really wrestle with this and kind of lay the foundation of where do we want to go. Next slide. So for us, several things happened. Once we got clear on what we wanted to do and be a part of the prevention programming that was happening across the country, we looked locally. We started thinking we're going to help Washington County and thought about the whole county. And actually, Paul DiLorenzo, who's on this call, gently tapped us on the shoulder and said, I know you like to go big, but why don't you pick a zip code, pick an area? And we said, yes, sir. So as we went through that journey, we started to share the vision with the community of SanMar's been known in this way. We'd like to kind of come alongside other efforts and see what we can do. We learned from others like Jackie's program and other places across the country of how they went about implementing prevention programs. We looked locally at our data, and then we started doing the work, right? We started to get into the place of how do we do this? We had no money to do this at all. $0. So it took a foundation of the organization, the board, the CEO, others saying, we're willing to do this because it's the right thing to do. And if we pursue the right thing long term, we believe that we'll make a case that this is a better way of operating, right? So in the stages of change framework, we think about that and say, we made a commitment. It's going to be hard. And in Jackie's point, it is very hard to do this, but it's redeeming. It's satisfying because you know that the work that you're doing is preventing the things that you're seeing every day in our past experience, you know, and to some extent, our ability to stay a little bit engaged in a lot of that reminds us of why we're doing this prevention work in the first place. Really important things that we got to remember. We did receive some funding after a couple years from a local foundation that was transformative for us, but they had to be flexible and patient. When we gave them a plan, it was not very well developed. It was basically conceptual and talking about the direction we wanted to go. Would they walk that journey with us? So it required that same kind of adaptability and flexibility from the funder. When we started thinking about what we were going to do, we didn't want to just start creating our own services when there was already stuff in the community. We wanted to partner there and come alongside those services first. So a lot of our initial meetings with partners were, what are you doing and what's missing? And how can we either help you do what you're doing, or how can we potentially fill a gap ourselves? Turf and resources are a big unspoken conversation. There's only a little bit of money, and there's a kind of ownership around certain responsibilities. Nobody wants to kind of hand off to someone else unless there is trust there. One of the things I think what has maybe differentiated us a little bit is we have consistently said, don't get stuck in just doing social services when that comes to child welfare specifics, because there are so many holistic factors that lead to well-being, right? To family well-being. Families may not need case management. Families may not need housing. It depends on what they're asking for. What they need is what they tell you they need, and how do we come alongside that and help that become a stronger family? Next slide.
Action is when individuals begin to take action steps to change behavior, thus creating a new pattern of behavior.
So when we started, this is, again, the really important thing. Everybody wants to start doing something, but when we think about starting to do something, what is that built upon? So here's just some examples, some quick snapshots of different events we held, training. When we started thinking about how we transfer our knowledge of and specialized expertise of working with kids and families, we pointed to bringing in other speakers. You know, we're nobodies. SanMar is just a reputable organization working in foster care. So we started to align ourselves with nationally recognized speakers that could come in and tell the exact same story we were saying, but do it in a very dynamic way and relate the message, right? Do it give them the message from a different person. So when we think about kind of the three levels of the work that we do, you know, the couple comments that we talk to our staff about are related to the 3 R's by Bruce Perry. So the brain science mixed with kind of our values. And so Bruce Perry's 3 R's really start with regulation or listening, right? That's the way we accomplish that. Relating, as far as the way we build trust, and then reason as a way in which we bring about solutions. And what I've always thought was a really fascinating concept was the way that your brain works. It must go in order. I can't have a solution if I don't trust you. I can't trust you if I don't feel safe and like I can relate to you. And so when we're talking to our staff, they're approaching families and communities with those 3 R's. They're approaching folks with those values. And that's not always a narrow evidence-based practice. It's a broader approach. It's a broader framework. Evidence-based practices will fit in there and mingle in there, but it's really about our broader agency coming into a community and being a partner for change. These slides have Dr. Robert Anda, who really focused on the regulation and trauma-informed care, right? Listening. Father Boyle, who's really about strengths approaches and relationships. as a way to build partnerships to move people forward. And then you see Jeff Canada talking about collective impact. So bringing in people that can tell the story sometimes is helpful. Next slide. And we got back to our why as an agency, right? So we picked up our services that traditionally existed as residential. We began to systematically close our residential programs and open community-based services. So as of 2016, we closed all our residential services. We had 6 different residential programs, and we began to open all of these different community-based services in the particular zip code. We did maintain foster care. We maintained an emphasis on that being our acute care program, with also a deeper emphasis on reaching out and collaborating with birth parents so that they were more a part of the process. We weren't just rescuing kids. We were collaborating with kids and their birth families so that kids could hopefully go home. We had an on-ground school for residential. We opened free local after-school programs through a grant through the state of Maryland's education. We had on-site medical and nursing care in residential. We opened a school-based health center. We had case management on-site for residential. We now do family services and do case management in the home. The residential programs created this kind of healing community.
On-site mental health care transitioned to outpatient mental health care services.
Now we do neighborhood organizing to make the community the healing place, not just our little residential place. We would train staff in a very specialized way. Now we train the whole community, right? We want to scale that up. And there were so many opportunities available for kids, but there was this precursor that you had to be traumatized. You had to have something terrible happen in order to benefit from the luxury of the services in residential care, and particularly kids that were coming from low income and disproportionately impoverished communities. So we wanted to put those resources in their neighborhood and hoping that that would be an impact. And finally, we would have all these different case plans available, and now we have a site, www.communitysolutionshub.org, where we have a longitudinal data measurement system that Washington County is looking at broadening. Next slide. Finally, sustainability. It's the hardest part, I think, of this work for me over the past 5 to 6 years. And it's important when you see all this. Again, I liked what Jackie was saying when she was talking about this all looks good on a slide, but it is a long, difficult journey to go through what we did. And the bigger challenge is that you're doing this without a huge amount of financial opportunities to pay for it. So, this is where your values and your beliefs about why you're doing it are so critical, because there are so many competing forces against your approach. But just to give you a snapshot, for a residential care provider, it could be $80,000 to $100,000 for one child to go into residential care for a year. And, if you think about 40 to 50 kids that we were having, that's $4 to $5 million that we would have annually for residential care.
In 2012, SanMar housed 42 females in residential services. SanMar closed residential services in 2016, but maintained foster care treatment.
Well, with our integrated prevention array, all those things that I'm telling you about, to have a variety of family services workers, all the after-school programming, neighborhood organizing, it's about $1 million for us for what we're doing at this stage.
The integrated service array provision began in fall 2015. The cost of an in-home family services program is $850,000. The cost of a free after-school program is $400,000. The cost of neighborhood organizing efforts is $100,000.
And we're serving probably 10 to 20 more, 10 times more people and in their families and better. And so I think the lesson here is it's not only a wise economic investment because you're helping people earlier, you're saving money, but we want to make sure that as an agency that government who looks at this and tries to identify this strategy for their community, I don't want you to reinvest this in roads. I want the money to come back into community-based organizations and community-based programs to create a pipeline for prevention that is scalable. And I think if we do that long term, as much as I want organizations to look at this and say, I'm doing it because I believe in it, really, organizations that are able to do this need to be able to pay for it. And that's where government at the state and federal level needs to find less about the ideas around the beliefs and more about how government is going to just ultimately long-term help to underwrite this the same way they would for residential and foster care.
Compare administrative costs to those expenses in county, state, or federal government costs. Communities need permanent, reliable funding to consistently build upon.
All right, next slide. I think that's it for me. If folks want to take a look at any of these references, they're available to you. We did a concept document when we first started.
SANMAR's references include SANMAR Children's Home, 2015 January, Prevention as an Organizational Approach, concept document, http://besterhope.org/flip. Casey Family Program, 2016 November, Making Life Better in Bester, focusing on families to improve outcomes for kids. Website, http://media/Hagerstown_brief.pdf. Bester Community of Hope, the SANMAR Initiative, 2018, The Ripple Effect, 2017-2018 Annual Report, https://wp-content/upload/2018/11/web-san-mar_Bester Hope Annual Report_2017-2018.pdf. Bester Community of Hope, a SANMAR Initiative, 2019. Bester Community of Hope FY19 Annual Report, https://besterhope.org/wp-content/uploads/2020/05/BCOH Annual Report FY19_compressed-2.pdf.
It's at besterhope.org flip. Besterhope.org is also our community initiative website. And that just really talks about a lot of the core values and beliefs that we pulled together when we were first starting. You'll see a national article and some other annual reports about our community-based work, but I'll pause for now. Thank you.
All right, we wanted to talk a little bit today about just how philanthropy can support collaboration and partnerships. Paul's having a little bit of connectivity, so I'm going to step up and be a team player here. Philanthropy really has an opportunity to invest in government and nonprofits in a seamless, non-bureaucratic manner. And philanthropy can offer time, treasure, and talent and expand the reach of an initiative. It can bring other non-traditional partners to the table often and can really serve as an early or venture investor. And philanthropy sometimes enjoys that higher brand reputation than government, so it can really help to set priorities without some of those political encumbrances. And philanthropy can determine the time frame for an effort without the disruptions caused by elections or a sudden change in political priorities. Next slide, please. So how do we initiate and sustain these partnerships? It's really about creating those aligned values and to get to those common desired outcomes and investments. Create or designate an infrastructure for managing that initiative, and make sure that everyone is a partner and planner and not just a bankroller in this effort. Really understanding how to leverage each other's strengths and challenges for all of the entities involved is really critical. And then delineating tasks so that everyone has the opportunity to participate. It's really critical to meet and communicate regularly so everyone is on the same page, and having a forum, a place for disagreements. And we know oftentimes when there are multiple stakeholders at the table that we're not always going to agree on everything. And so having a process and a protocol in place for handling those disagreements is really, really critical to initiating and sustaining those partnerships. So we wanted to move into a panel discussion. If we could move to the next slide, please. And we hope to have time to connect to some of the participant questions that we know you all have had as they've been coming in. But we want to spend the next 10 minutes or 15 minutes or so just really talking with our speakers. And so I want to just ask a question, and I think I'm going to ask this to Keith. So Keith, as you think about how your community collaboration effort, how it was going, as you think about the factors, what were the ones that made it easy to accomplish? What essentially greased the wheels of having those meaningful partnerships and collaboration?
Well, there's a lot to it, but if we were going to drill it down into a couple key points, I think that it starts with what is it that our agency and individuals within the agency want to accomplish, and gaining knowledge, right? So proactively seeking out information about best practices elsewhere. This wasn't just like there's an evidence-based practice that exists in one place that we want to do for one person. This was more idealistic. This was existential in some ways for the organization, thinking ahead, saying, if we could do whatever we want to help families, what would we do? How do we do that? So I think having peers internally within the organization, like-minded people, that you have a culture as an organization where you allow that, and we don't just get stuck in, take X number of cases, do your deliverables, hurry up, right? You allow the space for that kind of thinking and creativity. And sometimes it's hard to get there, especially in certain kinds of higher level bureaucracies, because there are so many external pressures. But that's one thing. I think having a big brother is what we called him, Paul DiLorenzo for us, was a part of Casey Family Programs at the time. And so when Paul was part of Casey Family Programs, we were able to host meetings with our community. And we weren't having the meeting talking about how Sanmar was great. Let us do this. We said, Casey Family Programs is here. They're a big deal. And we would just kind of put the spotlight on Casey and say, and they're experts. They know this from all over the country. And maybe we should do something like that here. And Casey was able to own some of it. So if I was thinking about something that helped us move this along, we were mentally ready as an organization to do something. And then we had somebody like Paul and Casey that helped catalyze a local process that people were willing to listen to. It wasn't Keith's crazy idea. This is being done all over the place. Why aren't we doing it, right? And I think the last thing, which is I don't know that it's a grease the wheel thing, but it just takes courage. And that's not patting us on the back or anyone else on this call. I think it's just a reality that there are so many unknowns that you're walking into. And you just have to have a deep faith and belief that this is the right way to do this. And if this was my kid, this is how I would want this. If this was my family, this is how I would want this. Just one other small thought would be, don't get stuck in endless meetings with people that aren't going to work. Be in set time limits on how long you're going to have these meetings. We would do focus groups. We would do a few meetings about an action step, and we would start the first meeting, and we would say, at the end of these 3 or 4 meetings, we're going to begin doing work. And then at the end of the 4th meeting, we would be done meeting, and we would go do that work. We would reintegrate people into other ways, but we would always kind of revisit this idea of, I do not want to meet. Please do not waste all of our time. We're here to actually do something. So that's just one other kind of a small point to make.
That's a great story, Keith. I appreciate that. Paul, were you able to get back in?
Can you hear me?
We can. Oh, great. I'll turn things over to you then. We've got about 8 more minutes to have the rest of our panel conversation.
Well, that's fantastic. And I apologize to everybody. I'm not sure why all my technology is having a meltdown here in Philadelphia, but I apologize for that. And so glad and great to hear the work of all of these organizations. I've been especially close with Jackie and Keith over the years, but the New Hampshire work and the the technical skills that Friends organization has been able to share are all fantastic. I do want to go to another question about what strategies that they've used to break down the barriers. Maybe I can go back to Jackie on that. But what specific strategies did you think were helpful in breaking down some of the barriers that some of the organizations had to do this, to do this kind of collaboration, this deep-rooted collaboration?
I think Keith was absolutely correct in the examples that he gave. And I think for us, too, we started with acknowledging what had been done in the past and not to overlook it. It needed to be acknowledged. The community had to recognize that we meant business, but they wouldn't trust us if we didn't even acknowledge what had already happened and how the community had gotten to the point where it was. So we first started with acknowledging, yes, some mistakes were made, some mistrusts happened, and now we're going to, you don't know us yet, but you'll get to know us, and we want to work with you to establish anew. We recognize what has happened, but give us a chance to not necessarily make things right, because we didn't go in to try to wave a magic wand to make everything all right, but to acknowledge what had happened in the past and then to commit to doing things a different way and then to deliver on those promises. That was very much important. And as Keith said, not for us to tell the story, but, and not because you're moderating right now, but bringing you in because you didn't, you could be non-biased and you could come in and tell our story and say to the folks around the table, the community, as well as our elected officials and our city government, hey, they're doing something good here. And we would know because, in your instance, you were Casey Family Program, the child welfare expert in the country. So that helped a lot because a lot of times, sometimes people won't listen to the story coming from within, but they will listen to somebody telling a story from outside. And that helped us in a lot of instances to bring you to the table and to have you share our story. But that helped to break down some of those barriers. But most of all, acknowledging what had happened and then making the commitment to do something different and then delivering on that commitment. And it helped because they saw that we meant business. Go ahead, Paul.
And I always felt that from both you and Keith that I learned as much as I brought, and I continue to do so. But, I think having, Nicole walk through our slides and content around the role of philanthropy, and I really encourage all of the partners that are on the call today, if you can involve even a small foundation in your community. It doesn't have to be a big national foundation. They bring something that really is unique and helpful and neutral in many ways. So thanks, Jackie. That's really, really good information. Mary Jo, Borja, Athena, let me get to you and ask you, what do you think people can do to get started today or next week, next month? Instead of just kind of talking about it, what are some small incremental steps that they can take that can start bringing the work to life and getting people energized? Or if they're doing something now, how do they, infuse some additional energy into their work? And Mary Jo, let's start with you and then go to our friends over in New Hampshire.
Sure, thanks. I would say take advantage of the unprecedented opportunity that we're living in right now to collaborate. What we heard from Keith and Jackie are that it starts with a common agenda, and that means to come together collectively and examine and lay the foundation, define the problem, the how did we get here conversation, create a shared vision to solve it, and establish a way to measure or know when you're making progress. And, I would jump into that collaboration toolkit that I showed earlier and focus on an element to incorporate into your work with those who are willing to share or entertain your vision. And for me, what jumps to the forefront is mindset. In the community toolbox, there's materials and activities to create or maintain coalitions or partnerships, as well as to assess and map community needs and resources. Or look at authenticity, where you might explore things like Brene Brown's talk about on vulnerability, or the community toolbox resources that really talk about conducting those public forums and those listening sessions in ways that engage and support authenticity of community members and allow for the voices to be heard.
That's a good point. Yeah. How about our friends in New Hampshire? We have just a moment or two left. Maybe get your thoughts about how to get started.
Thank you. Thank you. I totally agree with Mary Jo about sort of the framework for that collaboration, how it's crucial. The other thing that has come up here, and I can't stress enough, is building trust. And each state is at a different level. But I'll tell you, when I moved to New Hampshire 7 years ago, our partners, our providers were not meeting. We didn't have a trade association. And before you go to the state and try to establish a partnership in a program or this level of collaboration that we've had, you really first need to establish sort of your partnership with the community and then really engage the state in partnerships. One of the things I will tell you that doesn't help, if getting one of those grants that forces these collaborations, if there's not groundwork before that's done, those are, recipes for failure. So I think I would add the trust, and that is like a now, a later, and a forever work to do.
Yeah, I would agree with what Borja's sharing, and just add the relationship piece, how important that is, and just understanding kind of I think we talked about this earlier, but kind of what your vision is, what your mission is, and then who are the partners that you're missing, and engage them. And I one of the things I've enjoyed about my position in New Hampshire is I'm constantly, reaching out or sending an email or picking up the phone and calling and just saying, hey, tell me about what your program is. I think that's the kind of work that we really need to do and be comfortable doing to be able to develop those relationships. And the collaborative work. Yeah, the collaborative work in New Hampshire was really just, understanding that we can't do it on our own. We need to work together across systems to be able to do that. And I think once we accept that, we can really do great work.
I really like how the both of you kind of highlighted the incremental nature of this work, right? The small steps, but the small steps are really the foundation building, right? If you don't do that, you can't jump into the grand plans. And I think we heard that both from Keith and from Jackie as well. So, Nicole, I'm going to turn it back over to you. And again, apologize to everybody for my technological meltdown here, but glad I could join at least for this last little part. I was listening through the whole thing, but not able to talk. So.
Not
Nicole?
a problem, Paul. I know you would have done a fantastic job, and I'm happy to jump in and be a good team player.
Okay.
But this is the nature of our virtual world these days. I'm just going to go over a few slides just to close this out. On the next slide, please, is just a reminder that the Center for States is hosting our 2020 Child Welfare Virtual Expo on September 24th, and so you're able to register at that link there in the slide. The slide deck is available in the resources pod as a reminder. This year's topic is on strengthening families through prevention and collaboration, much of what we have been talking about today, and we're excited to feature some really fantastic sessions. And on the next slide, if I could just let folks know how to stay connected with the center. You can connect with us through our GovDelivery option there on the slide. You can connect with us through Facebook, Twitter, and LinkedIn as well. I would like to remind folks that there is an evaluation in the resources pod.
Sign up for news and updates at https://public.gov.delivery.com/accounts/USACFCBCS/signup/10906.
We would love to get your feedback on today's session and hear what you have to say so that we can continue to improve how we deliver our events to you all. And then on the very last slide, if you would like to reach out and contact us, there's also a widget in your platform there where you can contact us directly. We did have a few questions come in during today's session to our speakers in particular.
Contact the Center for States via the following. Website, https://capacity.childwelfare.gov/states/ or by email at capacityinfo@icf.com or by phone 844-222-0272.
And I just wanted to let everyone know that we will take a moment to reach out to our speakers and try to follow up with all of those questions via follow-up communication after today's session. And then one last thing, this event was a kickoff to a 2-event series. This event was really around how we build those collaborative partnerships with the folks that we need to have at the table to get to a prevention-oriented system. But in the resources pod, there is a registration link for our event next week, next Wednesday. We are going to look at, once you have those relationships built, how do you operationalize that? How do you make it work when there's so many different stakeholders with different systems and different technologies and different supports? So you're going to hear from Paul and another slate of speakers next week on how we operationalize these relationships in community collaborative work. So thank you all for joining us today. Thank you to all of our amazing speakers. You did a phenomenal job, and we look forward to speaking with you next week.